Assalamu alaikum wa rahmatullahi wa barakatuh. A good day, everyone. Another case, another question of the day. A 35-year-old male driver of a car involved in a high-speed car crash, complaining of right-sided chest pain, open auscultation of his chest. There was a decreased air entry on the affected side, dull to percussion. His vital signs showed blood pressure 85/63, pulse 122 per minute. So, again, if we digest this question and we try to break it down into a keywords, pretty much everything is important. So we have young male, he was driver, and we don't know if he was restrained or not. It was a very high speed car crash, and he's complaining of right-sided chest pain, and there is a decreased air entry on the affected side. So right-sided chest pain, decreased air entry on the affected sides. Two things in your mind should be: is it pneumothorax or is it hemothorax? So to differentiate between them is the pneumothorax, hyperresonant on percussion. On the other side, the hemothorax is dull to percussion. Again, his blood pressure is not good. It's 85, so low blood pressure and low pulse oximeter. So you got the chest x-ray, and this is the chest x-ray, and you can see there is a let's say, or increased opacity of the left lung. So let's say there is whitish material somewhere in the left lung, and it's covering almost 2/3. So instead of trauma or in trauma situation, this is a hemothorax. Okay, so the question that come up to you, that may come up in the similar case scenario: what's your diagnosis? So even without looking at the chest x-ray, you should get the diagnosis. It's a hemothorax, and you can add a massive hemothorax. So to me, massive hemothorax is almost equal to tension pneumothorax. So both of them are life-threatening. So what's the definition of massive hemothorax? This question always comes up in the exam. So there will be a drainage of more than 1,500 ml open chest tube insertion. Once you put the chest tube in, immediately you will get more than 1,500 ml of blood. The second definition is over the 4 hours. So you have drainage of more than 250 ml per hour for the coming 4 hours. That's the massive hemothorax. And the classic question is, what's the definitive treatment? So the chest tube is not a definitive treatment for massive hemothorax. The definitive treatment is a thoracotomy in the operation room. And if the patient arrested in your emergency department, so that means he scores an ED thoracotomy. The other important question that may come up in these cases, or in this case, is the classification of hemorrhagic shock. And we know that it has 4 classes: blood loss, 750 ml, 750 to 1,500, 1,500 to 2,000, or more than 2,000. Blood loss percentage, 15%, 30%, 40%, and more than 40%. Pulse rate, not tachycardic, tachycardic above 120, above 140. Blood pressure normal, but start to decrease in class 3 and start to decrease in class 4. Pulse pressure is normal, decrease, and decrease. Respiratory rate is either normal, then increased 30, 40, and more than 40 or more than 35. Urine output is almost normal, but start to decrease to the point it is negligible in the last class. CNS is important. It's maybe anxious. In class 1 is maybe anxious, and the remaining is start to get confused toward the end. This is the last update in a new ATLS guideline. They've added base excess, so 0 to -2, -2 to -6, -6 to -10, -10 or less. So they've added now the base deficit, the base deficit, yes, to the to the classification of hemorrhage. Now, as you can see, this is very annoying and very extensive table. So the easy way to remember in exams, unfortunately in exams they may get you numbers, okay? So you have to remember these numbers. But the quick way, the very quick way is in class 1, usually the patient will be only anxious. The remaining parameter is normal. But in class 2, everything almost normal except he will be tachycardic. Class 3, he will be tachycardic and low blood pressure. Class 4, he will be tachycardic, low blood pressure, and confused. So once you see these points in the exam, just remember this is a rough point. So normal except anxiety is class 1. Class 2 is just more likely to be tachycardic. Class 3 to increase blood pressure. Class 4 confused. So that's probably much all what you need to remember from this extensive detailed history. This is the case for the day, and I will see you in next series. Thanks so much.